As people enter their senior years, vitamins become more important than ever. Yet many older adults don't realize that some vitamins can be more harmful than helpful. The body changes dramatically after age 60. Absorption slows, organs work harder, and certain nutrients become more difficult to process. That's why experts warn that seniors must be extremely selective about which supplements they take. In fact, there is one particular vitamin many seniors take daily believing it boosts health, when in reality, it can stress the body, cause toxicity, and even damage long-term well-being. At the same time, there is another essential vitamin that seniors must take every day because it supports bones, muscles, nerves, and immunity in ways no other nutrient can. Understanding the difference between these two vitamins is critical. With the wrong supplement, seniors may experience fatigue, nerve pain, muscle weakness, digestive discomfort, headaches, or even more serious complications. But with the right daily vitamin, they can boost energy levels, sharpen memory, strengthen bones, protect their heart, and slow age-related decline. In this informative breakdown, we will explore why the worst vitamin can be risky for older adults and why the must-take vitamin is so essential for overall senior health. Most seniors are unaware of these facts because supplement companies rarely highlight the risks. Doctors, however, repeatedly warn that certain fat-soluble vitamins build up in the body and become toxic, while others are poorly absorbed or unnecessary. Meanwhile, the vitamin seniors should be taking daily is one that most adults over 65 become deficient in without realizing it, leading to fatigue, bone thinning, muscle cramps, and balance problems. By the end of this explanation, seniors and their caregivers will clearly understand how to avoid dangerous supplements and how to choose the right vitamin to maintain strong bones, healthy muscles, sharp cognitive function, and better immunity well into their 70s, 80s, and 90s. That many seniors take high-dose vitamin A supplements, thinking they support vision. But this is actually the worst vitamin for older adults to take in supplement form. Vitamin A is fat-soluble, meaning the body stores it in the liver and does not easily remove excess amounts. As seniors age, their liver becomes less efficient, and high levels of vitamin A can build up dangerously fast. This can cause symptoms like dizziness, bone pain, nausea, dry skin, hair loss, and even increased risk of fractures, because excess vitamin A weakens bones instead of strengthening them. Added to this, seniors often consume vitamin A from food sources such as eggs, dairy, liver, carrots, and leafy greens without realizing they are already meeting their daily needs. Taking a supplement on top of this pushes levels too high. Doctors frequently warn older adults to avoid taking vitamin A on its own or as part of high-dose multivitamins marketed for eye health. Research shows that chronic vitamin A overload makes bones brittle and increases fall-related injury risk, one of the biggest dangers for seniors. It can also suppress appetite, slow metabolism, and interfere with vitamin D absorption. Because vitamin A is stored long-term, toxicity can build slowly, often going unnoticed until symptoms become severe. Seniors with kidney or liver issues face even higher risks. This is why experts recommend getting vitamin A primarily from foods rather than supplements. Food sources contain natural forms that the body regulates carefully, preventing overdose. Seniors simply do not need additional synthetic vitamin A from supplements. Avoiding vitamin A pills protects bone density, reduces toxicity risk, and prevents unwanted side effects. Instead of vitamin A, seniors should shift focus to the one vitamin that plays a major role in preventing bone loss, improving balance, boosting immunity, and strengthening muscles, especially after age 60. That essential daily nutrient is vitamin D3, and it is crucial for nearly every function in the aging body. Now, let's explore why vitamin D3 is considered the most important daily vitamin for seniors. After age 60, the skin becomes less efficient at converting sunlight into vitamin D. Many seniors also spend more time indoors, use sunscreen, or live in areas with limited sunlight exposure. As a result, vitamin D deficiency becomes extremely common. Low vitamin D levels weaken bones, increase fracture risk, reduce leg strength, worsen balance, and raise the likelihood of falls. Vitamin D is also essential for muscle contraction, meaning without adequate levels, seniors may experience muscle cramps, joint stiffness, or overall weakness. but the benefits extend far beyond bones and muscles. Vitamin D plays a major role in brain health, helping regulate mood, memory, and cognitive clarity. Seniors with low vitamin D levels are more prone to depression, confusion, forgetfulness, and slower mental processing. Studies show that adequate vitamin D helps support better memory, attention, and neurological aging. Another key function is immune support. Vitamin D activates immune cells that protect against infections, reduce inflammation, and help regulate the body's response to viruses. Seniors with low vitamin D are more susceptible to colds, flu, chronic fatigue, and slow wound healing. Furthermore, vitamin D supports heart health by helping regulate blood pressure and reducing arterial stiffness. Many seniors do not realize that D3 deficiency can also trigger fatigue, low mood, and sleep issues. Because vitamin D, one of the biggest advantages of vitamin D3 for seniors is its powerful effect on bone density. After age 60, bones naturally become thinner due to hormonal changes, reduced physical activity, and loss of calcium from the skeletal structure. This process accelerates rapidly in adults over 70. Without enough vitamin D3, the body cannot absorb calcium properly, no matter how much calcium a senior consumes through food or supplements. This means that even if someone takes calcium tablets, drinks milk, or eats dark leafy greens, the calcium passes through the digestive system without entering the bones. Vitamin D3 acts as the key that unlocks the doorway for calcium to enter bone tissue. When seniors take D3 daily, they improve bone density, reduce fracture risk, and protect themselves from osteoporosis. For older adults, especially those with mobility issues, strong bones are essential for preventing life-threatening injuries. Hip fractures, for example, are among the most serious injuries a senior can suffer, often leading to long-term disability. Vitamin D3 is one of the simplest and most reliable ways to lower that risk. Additionally, vitamin D3 reduces chronic inflammation, a hidden factor behind joint pain, stiffness, fatigue, and bone discomfort. Seniors with arthritis often notice significant improvement when they maintain healthy vitamin D levels. The vitamin also supports healthy cartilage, which cushions the joints and prevents grinding or pain during movement. Another overlooked benefit is posture. Weak bones in the spine can lead to stooping or hunching over, which strains the back and increases fall risk. Consistent D3 intake helps maintain spinal strength and stability. Seniors who take vitamin D3 report feeling more confident in movement, better supported, and more capable of performing daily activities like climbing stairs, walking long distances, or standing up from a chair. In short, vitamin D3 acts as an essential foundation for skeletal health, mobility, and independence. A fascinating benefit of vitamin D3 for seniors is its profound effect on muscle strength. Muscles rely on vitamin D3 to contract properly, which means deficiency can lead to cramps, weakness, trembling, and difficulty maintaining balance. Seniors often notice that their legs feel shaky, their grip weakens, or they fatigue quickly when walking. Symptoms commonly misinterpreted as just aging. In reality, a major underlying cause is low vitamin D. When vitamin D3 levels are low, the nervous system struggles to send signals to the muscles. This results in delayed reactions, slower reflexes, and increased risk of falls, especially when walking on uneven surfaces or climbing stairs. Studies show that seniors who take vitamin D3 daily significantly improve leg strength, walking speed, stability, and muscle coordination. This is why doctors often recommend D3 supplementation for seniors dealing with frequent falls or balance issues. Vitamin D3 also plays a key role in preventing muscle wasting. As adults age, they naturally lose muscle mass, a process called sarcopenia. But maintaining optimal vitamin D levels slows this decline dramatically. Combined with light activity like walking or stretching, D3 enhances muscle protein synthesis, helping seniors retain strength even in advanced age. Another important factor is pain reduction. Vitamin D deficiency often causes deep, persistent muscle pain that feels similar to fibromyalgia. This pain can make exercise or simple daily tasks difficult. When seniors restore their vitamin D levels, this pain frequently decreases or disappears entirely. Additionally, vitamin D3 improves mood and energy levels, which further increases motivation to stay active, creating a positive cycle of health. For seniors, strong muscles are more than just a comfort. They are the foundation of independence. The ability to get out of bed, walk to the bathroom, carry groceries, or play with grandchildren depends heavily on muscle strength. Vitamin D3, taken daily, becomes one of the simplest and most effective tools for maintaining mobility and preventing age-related muscle decline. Another crucial reason seniors must take vitamin D3 daily is its impact on the immune system. As people age, the immune system weakens naturally, a process known as immunosenescence. This makes seniors more vulnerable to infections, slower healing, and chronic inflammation. Vitamin D3 plays a critical role in activating immune cells that protect the body from viruses, bacteria, and harmful pathogens. Research shows that low vitamin D levels correlate strongly with higher rates of respiratory infections, such as colds, flu, and pneumonia. Seniors with vitamin D deficiency also take longer to recover from illnesses and are more likely to experience complications. On the other hand, maintaining healthy vitamin D levels strengthens the body's first line of defense. It boosts the activity of T cells and macrophages, immune cells that identify and one of the most overlooked benefits of vitamin D3 for seniors is its powerful influence on brain health and cognitive function. As people age, the brain naturally undergoes structural and chemical changes. Memory slows, reaction times lengthen, and the risk of cognitive decline increases. Vitamin D3 acts like a brain-supporting hormone, helping regulate mood, memory, learning, and concentration. Seniors with low vitamin D levels are more likely to experience forgetfulness, mental fog, difficulty focusing, and even symptoms of depression or anxiety. Researchers have found a strong link between vitamin D deficiency and higher risk of dementia and Alzheimer's disease. This is because vitamin D receptors are found throughout the brain, meaning the brain literally depends on vitamin D to function properly. When vitamin D levels drop, communication between brain cells becomes slower, inflammation increases, and the brain's protective mechanisms weaken. On the other hand, restoring vitamin D levels enhances neuron communication, reduces inflammation, and supports the brain's ability to repair itself. Vitamin D also helps regulate mood by supporting serotonin production. Seniors with low D3 often feel tired, sad, irritable, or unmotivated without knowing the cause. When vitamin D levels rise, mood typically stabilizes, energy increases, and mental clarity improves. Another important factor is sleep. Vitamin D helps regulate the sleep-wake cycle, circadian rhythm. Many seniors struggle with insomnia, restless sleep, or waking up frequently at night, issues often linked to vitamin D deficiency. A daily dose can help improve sleep quality, which then enhances daily alertness, memory, and overall well-being. Since the brain consumes a large amount of energy each day, vitamin D's ability to support mitochondrial function also ensures better mental performance. All these benefits make vitamin D3 one of the most crucial nutrients for protecting aging brains and maintaining independence. Vitamin D3 also plays a major role in heart health, which is especially important for seniors. After age 60, the cardiovascular system becomes more vulnerable to high blood pressure, arterial stiffness, weak circulation, and heart disease. Vitamin D supports heart function in multiple ways. It helps regulate calcium balance in the bloodstream so that calcium enters the bones rather than accumulating in the arteries. Without adequate vitamin D, calcium can deposit on artery walls, causing stiffness and increasing the risk of heart attack or stroke. Maintaining healthy vitamin D levels helps keep arteries flexible and blood flowing smoothly. Another benefit is blood pressure control. Studies show that vitamin D deficiency is linked to elevated blood pressure because vitamin D plays a role in relaxing blood vessels and reducing stress hormones. Seniors who maintain proper vitamin D3 levels often see improvements in blood pressure and circulation. Vitamin D also reduces inflammation inside blood vessels, inflammation that, over time, damages artery walls and contributes to plaque buildup. Lower inflammation means better heart protection. Furthermore, vitamin D supports the functioning of the heart muscle itself. The heart is a powerful muscle that contracts nonstop. It needs adequate vitamin D to maintain rhythm, strength, and endurance. Seniors deficient in vitamin D are more likely to experience irregular heartbeats, fatigue after light activity, and breathlessness. Additionally, vitamin D improves insulin regulation, which is important because seniors with diabetes or prediabetes are at higher risk of heart complications. With balanced blood sugar, the risk of heart damage is lower. Overall, vitamin D3 helps maintain strong circulation, healthy arteries, stable blood pressure, and efficient heart function, all of which are essential for seniors who want to remain active and independent. Another reason vitamin D3 is essential for seniors is its role in reducing chronic pain. Many older adults live with persistent aches in the back, knees, hips, shoulders, or muscles. Much of this pain is mistakenly blamed solely on age, but in reality, vitamin D deficiency is one of the most common hidden causes of chronic pain. Vitamin D helps regulate the nervous system, reducing the sensitivity of nerve fibers that send pain signals. When levels are low, nerves become hypersensitive, meaning even minor inflammation or pressure can feel painful. Seniors with low vitamin D often describe deep bone pain, muscle soreness, stiff joints, or tenderness in the ribs or spine. Researchers have found that restoring vitamin D levels can significantly reduce these symptoms. Vitamin D also reduces inflammation in joints and muscles, which helps ease arthritis-related pain. Seniors who take vitamin D3 daily often notice that they can move more freely, walk with less discomfort, and experience fewer muscle spasms. Another benefit is improved posture. When vitamin D deficiency weakens core muscles and spinal bones, the spine may tilt or compress, leading to back pain. Strengthening these structures through D3 supplementation helps maintain a healthy posture and reduces strain. Additionally, vitamin D supports the body's pain control hormones and neurotransmitters, promoting a more natural sense of comfort and relaxation. For seniors who frequently rely on pain medications, improving vitamin D levels may reduce the need for daily painkillers. This lowers the risk of side effects associated with long-term. Vitamin D3 also plays a crucial role in maintaining hormonal balance in seniors, which is often overlooked but extremely important for overall health. As people age, hormone levels naturally decline, especially those related to growth, repair, mood, and metabolism. When these hormones drop, seniors may experience fatigue, low mood, muscle weakness, slow healing, weight gain, and decreased motivation. Vitamin D functions like a hormone itself, meaning it directly influences how other hormones behave. Maintaining healthy vitamin D levels helps regulate insulin, thyroid hormones, stress hormones, and even sex hormones. One major benefit is improved thyroid function. When vitamin D is low, thyroid hormones struggle to maintain metabolism, which leads to sluggishness, cold sensitivity, and low energy. With adequate vitamin D, the thyroid performs better, supporting metabolism and body temperature regulation. Vitamin D also helps balance cortisol, the stress hormone. High cortisol levels can cause inflammation, poor sleep, weakened immunity, and increased belly fat. Seniors with healthy vitamin D levels often experience a calmer mood, reduced stress, and better emotional stability. For women, vitamin D supports bone and hormone health postmenopause by working with calcium to maintain strong bones. For men, vitamin D can support testosterone levels, which helps maintain muscle mass, strength, and motivation. Another important aspect is sleep regulation. Vitamin D helps maintain melatonin levels, the hormone responsible for quality sleep. Many seniors struggle with insomnia, nighttime waking, or restless sleep, symptoms often linked to low vitamin D. When D3 levels are restored, sleep patterns become more stable, improving daily energy and mental clarity. Because hormones impact almost every body function, maintaining balance through adequate vitamin D is one of the simplest yet most effective ways to support aging gracefully. Vitamin D3 also supports digestive health, which becomes increasingly important as adults grow older. Seniors often experience constipation, poor nutrient absorption, bloating, or digestive discomfort due to a slower digestive tract and reduced enzyme production. Vitamin D assists in maintaining a healthy gut lining, which prevents harmful bacteria from entering the bloodstream and causing inflammation. It also supports the production of antimicrobial peptides, natural compounds that help control harmful bacteria in the gut while supporting beneficial strains. This balance is essential for digestion, nutrient absorption, and immune strength. Many seniors also suffer from low stomach acid, which affects the breakdown of food and reduces absorption of key nutrients like calcium, magnesium, and B vitamins. Vitamin D enhances calcium and magnesium absorption in the intestines, helping strengthen bones and support muscle function. Vitamin D deficiency is also linked to digestive conditions such as irritable bowel syndrome, IBS, inflammatory bowel disease, IBD, and chronic constipation. Seniors who restore their vitamin D levels often experience improved bowel movements, reduced bloating, and better appetite. Because vitamin D acts as an anti-inflammatory nutrient, it helps calm an irritated digestive tract. Another key benefit is its role in supporting the gut-brain axis, the communication pathway between the digestive system and the brain. Seniors with healthy vitamin D levels often report better mood, reduced anxiety, and improved mental clarity due to healthier gut function. Vitamin D also supports pancreatic health, improving insulin regulation and helping prevent blood sugar spikes after meals. Altogether, vitamin D3 supports a healthier digestive system, better absorption, and smoother daily functioning. Key factors in senior health and comfort. Vitamin D3 is also essential for maintaining energy levels, something many seniors struggle with daily. Fatigue is one of the most common signs of vitamin D deficiency, yet it is frequently misdiagnosed as simply old age. Vitamin D influences energy in multiple ways. First, it supports the mitochondria, the tiny power generators inside every cell that produce energy. When vitamin D levels are low, mitochondrial function slows down, leading to constant tiredness, heaviness in the legs, and reduced motivation. Restoring vitamin D levels boosts cellular energy production, helping seniors feel more active and capable. Vitamin D also improves oxygen transport by supporting healthy red blood cell formation. With better oxygen delivery to muscles and organs, seniors experience improved stamina during walking, climbing stairs, or daily tasks. Another important factor is mood. Low vitamin D is strongly linked to depression and low mood, which often drains energy and reduces the desire to move. When vitamin D levels improve, motivation increases, stress decreases, and overall energy rises. Vitamin D also supports stable blood sugar levels, preventing energy crashes after meals. Seniors who take vitamin D regularly often report that they can stay active longer, complete tasks more easily, and feel more enthusiastic throughout the day. Additionally, better muscle strength, one of the key benefits of vitamin D, naturally increases energy because the body uses less effort to perform daily activities. Improved sleep quality, another result of adequate vitamin D, also contributes significantly to better daytime energy. Overall, vitamin D3 creates a positive chain reaction: better sleep, improved mood, stronger muscles, healthier blood sugar, and enhanced cellular function, all of which lead to higher energy and better overall vitality in seniors.